Dr. Cassi from NABC's Vetfolio and the host of Vet2Vet. Parasites are a year-round concern in most veterinary clinics, so it's important to continue to engage with our clients about tick control for their pets. Joining us is Dr. Kathryn Reif. Dr. Reif is an associate professor in the Department of Diagnostic Medicine and Pathobiology at the College of Veterinary Medicine at Kansas State University. Her research interests revolve around ticks and tick-borne diseases of veterinary, agriculture, and medical concerns. Dr. Reif, thank you so much for joining me today.
Really happy to be here. Thanks for having me.
So, jumping right in, where do we find ticks and subsequently Lyme disease? Where have we found ticks historically and where are they moving to?
Sure. So we can find ticks pretty much in most places where we look in the U.S., with some rare exceptions of very arid regions in the desert. And there's actually even ticks still there, although they're less of a concern for us and our pets. But pretty much throughout the U.S., we can find disease-carrying ticks of concern for both us and our pets. If we're thinking about Lyme disease in particular and the ticks that transmit that particular pathogen, we find them primarily in the eastern part of the U.S. in really high densities in both the northeastern quadrant of the U.S. as well as the upper Midwest. But we can find populations of them really in the South as well. So people living in the South are still at risk, albeit a little bit of a lower risk for Lyme disease. And then we can find a different species of ticks that transmit that same agent that transmits Lyme disease in the West Coast regions of the U.S. as well, along the Pacific coast and inland a little bit.
So a little bit of everywhere. So having a hot, dry summer in the South is not going to count as an arid region that's going to save me from ticks.
No, not at all. You'd have to be pretty much in the middle of the desert to really avoid a good tick risk.
Goodness. I had a feeling that's what you were going to say. And from what I understand, these ticks are spreading geographically. Is that correct?
Yes. So ticks are rapidly on the move, and we're really experiencing a situation where there's just now more ticks in more places. Warming climate trends have contributed to the northward expansion of several really important tick species, including Ixodes scapularis, the black-legged tick or the deer tick, which is the vector of Borrelia burgdorferi, the agent of Lyme disease. So now we're seeing both northward expansion of this tick species. We're seeing it move. Right now, I'm doing this recording from Ohio, and Ohio is one of the states where growing up here 20, 30 years ago, we never really ran into ticks. And now it's a new hotbed of these black-legged ticks and Lyme disease as well. So we're seeing kind of an oozing of these tick populations out of their more historic ranges and into places where we haven't previously appreciated them in great numbers.
I also remember growing up in the Midwest and, if somebody got a tick on them, it was this huge big deal because we didn't really have a whole lot of them. So we know that they're expanding geographically. What about seasonality? Is there a seasonality for ticks or a time of the year that we're safe, so to speak?
Sure. In general, people really think that tick season starts during the warmer times of the year. But in fact, it's typically warm enough throughout all months of the year for ticks to be active. Not all tick species or even not all life stages of a given tick species are active at the same time of year. So it's really important to know what tick species reside in a given area, and that will differ based on where you are regionally in the U.S. and when the different life stages of those tick species are out, because that'll inform whether or not the risk for getting bit by a tick is likely. And then if you know what tick species are in your area, you also have a good idea of what potential tick-borne pathogens are also in your area. So we have lots of ticks that are out in those warmer spring, summer into early fall months, but we have a collection of different tick species, some of which are really important for canine health that are out in our cooler early spring into winter into late fall months as well. So pretty much if it is over 35 degrees Fahrenheit, that is a temperature where ticks may be active. there may not be a lot of ticks active in that temperature range. They start getting a little bit more active in the 50 degree or warmer, 50 degree Fahrenheit or warmer temperatures, but we can still actively find host-seeking ticks when it's 35 degrees or warmer. So pretty much anything above freezing.
Gosh, and at the time of this recording, I'm recording from Florida, so it's almost always over 35 degrees.
Yeah.
So this is something that I have really wondered, and I think the answer is a little bit variable, but I'm really interested to hear your answer. How long do ticks have to be attached in order to transmit disease?
Sure. So it really depends on the specific disease causing agent that they're carrying. Our tick-borne viral pathogens can be transmitted in a matter of minutes, and those are pretty scary pathogens. And we don't see too many cases of them in reality, but when we do see cases or when they are able to be studied, transmission, as I mentioned, can happen in a matter of minutes. But our more common tick-borne bacterial pathogens, so here we're thinking about agents of Lyme disease, anaplasmosis, or ehrlichiosis, they're most efficiently transmitted after that tick has been on the host for 24 hours or more. In laboratory studies where they've evaluated the time for Borrelia burgdorferi, the agent of Lyme disease, to be transmitted, no study using a U.S. sourced population of the black-legged tick or U.S. strain of Borrelia burgdorferi demonstrated transmission within 24 hours. So we really want to use, when we're thinking about using tick control products on our pets or reducing our own personal risk of tick-borne disease transmission, if we can identify and remove ticks within that 24-hour period, or we can rely on good tick control products to kill those ticks on our pets within 24 hours, the risk is going to be pretty low. So that 24-hour mark is a really good time estimate for Borrelia burgdorferi, but some of our other tick-borne bacterial pathogens like Anaplasma, Phagocytophilum, and the Ehrlichia species may be transmitted even a little bit more quickly. Studies have shown that Anaplasma Phagocytophilum, the agent of anaplasmosis for people and pets, can be transmitted as quickly as about 16 hours, perhaps, after tick attachment. And the Ehrlichias are largely unknown, but there's some international data suggesting that they may be transmitted within only a few hours of attachment, maybe only 3 to 4 hours. But there have been no studies done in the U.S. with U.S. strains of ticks or Ehrlichia species to really confirm that in our context here.
Goodness. And, you know, of course, here we're talking about Lyme disease, Anaplasma, Ehrlichia, and these types of diseases. But can we just go back for just a second? Because you mentioned viral tick-borne diseases. That's actually, I don't think something that I'm very familiar with even existed. Is this a new reason for me to be afraid of ticks? I really don't need another reason to be afraid of ticks. But can you elaborate on those just for a minute here?
Sure. Over the past 20 years or so, we've had a lot of different emerging tick-borne viral diseases. They're still pretty rare, but some of the ones that people may have heard about in the news before would include Powassan virus. And so that's a virus that's transmitted by the same tick species, the black-legged tick that transmits Borrelia burgdorferi and Anaplasma phagocytophilum. And then we have some even more recent tick-borne viruses, Bourbon virus and Heartland virus, which are associated with being transmitted by the Lone Star tick. Studies using these tick-borne viruses have to be done in biosafety labs that are like level 3 or level 4. So these are, for people that are unfamiliar with that, like the spacesuit type lab. So we really don't have a lot of information about these tick-borne viruses other than the fact that their case fatality rate can be pretty high. We have almost no idea about these tick-borne viruses in the context of companion animals because those types of studies would have to be done in these really high security laboratories. But I don't want to worry people too much because these are very rare viruses. But it is important to know that these ticks transmit a whole variety of things, and these tick-borne viruses are pretty scary. I definitely will leave studying those to somebody else.
I'm going to just briefly adopt denial here because, like you said, they are fairly rare. And, kind of going back to some of the things that we see more commonly, of course, in Florida, and it sounds like emerging in other parts of the country as well, it's not uncommon to find ticks on animals, on ourselves at all. So if we were to find a tick on ourselves, on our animals, how likely is it that a tick is carrying Lyme disease or another tick-borne disease?
Sure. So that also depends on regionally where you may be in the U.S. So how common may we find a tick on our pet or ourselves? Some of that is dependent on the risk factors in our normal daily routine. Are we out and about walking our pets on trails? Are our pets on trails? Are they going through wooded areas or heavily grassed areas? So they're probably at a lot greater risk, and we're probably at a lot greater risk for having a tick come on to us than we probably appreciate. And ticks are really stealthy critters too. If they're climbing up your clothing or on a pet's fur, we have really no sensation of being able to feel them unless they're kind of interfering with some of our hairs. And then once they attach, whether it be to us or our pets, they pretty much secrete this whole pharmacy into the skin of their hosts that masks their presence from the host's immune system. So they don't really induce an itchy response. And so we may notice flea infestations on our pets, or hopefully not on us, because we're itchy, right? Or our pets are itchy, but ticks are like super stealthy critters, and they just, mask their presence, and they do that through all of their fancy salivary proteins that they generate. And then with regard to how common it may be for them to carry pathogens, again, that's going to be really regionally, it's going to be different. In some areas, maybe only less than 5% of ticks are infected with a given pathogen. But if we get up into areas in Pennsylvania, New York, Maine, there may be upwards of 90% of the adult life stages of those tick species carrying some sort of pathogen. That's a really intimidating scenario. And it only takes one tick to be able to transmit these tick-borne pathogens and potentially induce a tick-borne disease.
These ticks, of course, they can, evade immune response in addition to all the other fun things that they can do. So let's narrow our focus here a little bit more towards Lyme disease. And Lyme disease in animals can be different from what we see in humans. Is that correct? How often do we see clinical signs associated with infection? And what are those clinical signs? What's kind of the prognosis? What should we expect in dogs with Lyme disease?
I'll actually back up a little bit and first mention what I think is a really important difference between when dogs are at risk for Lyme disease and when people are at risk for Lyme disease. And that's going to be dependent on whether it's the adult life stage of the black-legged tick or the nymphal or the juvenile life stage of the black-legged tick, when each of those life stages are out. Now, people typically contract Lyme disease through the bite of an infected black-legged nymph. And these nymphs really like the warmer weather. So they start to emerge in kind of mid to late spring, once again, depending on regionally where you are in the US. And they're pretty much out throughout the summer, and then they go and kind of hibernate when the fall starts coming along. But the nymphs, they don't really care for dogs so much. Now, the adult life stage of the black-legged tick love dogs, and they'll happily feed on a dog. But this life stage is a cold weather loving tick. So they're going to be emerging in the late fall. In many places, they'll be out throughout the whole winter months and then again into early spring. And so that's when our dogs are at greatest risk for potentially being bit by this black-legged tick and potentially contracting Lyme disease or anaplasmosis, because both of those diseases are transmitted by this same tick. Another difference between kind of canine and human Lyme disease is the likelihood that either dogs or people would develop clinical signs. So in general, about 90% or so of people that get Lyme disease or get bit by an infected tick will develop some type of clinical signs of Lyme disease. And most commonly, that'll be a fever. A lot of people will develop that classic bullseye rash, but it doesn't always have to be the bullseye rash. Honestly, it can just be kind of a different looking rash as well, but pretty focal still. But in contrast, our dogs, most of the time when dogs are infected with Borrelia burgdorferi, they will not develop clinical signs of disease, or at least overt clinical signs of disease. And so sometimes I think people are like, well, we found a tick on our dog, but they seem to be doing fine, don't need to worry. Or, they tested positive for Borrelia, but they didn't seem to look otherwise unhealthy, so don't need to worry. But I don't think that's necessarily the case either. Although they may not develop overt clinical signs of Lyme disease, in the majority of dogs, they do actually develop some subclinical asymptom or subclinical signs of Lyme disease. And then in some dogs, they'll actually go on to develop a much more significant chronic manifestation of the disease, characterized a little bit more by frank arthritis or kidney disease, where they'll develop glomerulonephritis. And in those dogs, the prognosis can be quite poor.
When it comes to this subclinical disease, with Lyme, can we talk about the blue dot? What do we do about the blue dot? Do we treat the blue dot knowing that many of our patients will develop some sort of subclinical disease?
That's a very individual decision to make between the veterinarian and I think their client. And, hopefully they have a good patient, or a long patient relationship as well, so that they can kind of know the history of that dog. Was it the first time that the blue dot appeared, or is this dog always blue dot positive? And I think for those dogs that are seropositive for Borrelia burgdorferi, it's important to evaluate some additional parameters on that dog to run a CBC, to look at protein levels and to do a urine analysis and look at protein levels in the urine. Those can be some early indicators that this dog may be suffering from more complications of Lyme disease. And for those dogs, they definitely benefit from then, being treated with a round of antibiotics. There's no consistent evidence that shows that giving dogs antibiotic treatment that are otherwise healthy and seropositive for Lyme necessarily wards off any subsequent clinical likelihood of chronic clinical diseases. But it does tell you that dog is living or existing or traveling to areas where there's infected ticks, because otherwise they wouldn't be blue dot positive. So really we need to take then a more proactive approach to look at, okay, what's the tick control regimen that this dog is on? This dog would absolutely be a really good candidate for getting one of the canine Lyme vaccines as well. So I think we need to have a more proactive take on these blue dot positive dogs. But certainly any dog that has any type of clinical signs and is seropositive, antibiotic treatment should be a consideration.
Sure. And, you brought up the Lyme vaccine because we know that this dog is traveling to areas with infected ticks. In addition to the Lyme vaccine, what kind of options do we have for tick protection and protection against tick-borne diseases?
So I think a really basic standard of care for pretty much every dog living in the U.S. is the necessity of that dog being on some kind of tick control, some kind of tick control product, and ideally 12 months out of the year. I think we can look at tick protection from a variety of different angles. We can look at protecting our pets from the ticks themselves, and we can look at protecting our pets from the pathogens that some of these ticks may carry. So in terms of protecting our pets from the ticks themselves, my favorite method of tick control would be the use of a year-round tick control product. And within the kind of universe of tick control products, in my opinion, the isoxazoline class of drugs are really quite superior. So they are the systemically distributed drugs that provide full body protection from the tips of those dogs' toes to their tail to their nose. So depending on the specific isoxazoline product, some of those products are formulated into our typically monthly administered products, which a lot of people associate the need for monthly use of these tick control products. But then there's another product that's available in an extended duration form. So perhaps for these less compliant owners that struggle with giving that monthly dose of a tick control product, an extended duration product might be a better solution for them. I know I have my pet is a standard poodle. Her name is Lucy. And I frequently find myself in situations where I'm looking at her and I'm like, Lucy, did I give you your tick control product? And she's not very happy or helpful. She like shakes her head and spits her tennis ball out at me. And then even sometimes I'll put like reminders in my phone, and the calendar notification, the reminder will go off, and I'll say to myself, okay, I'll do that when I get home. And then, once again, a week later, I'm looking at Lucy and I'm like, did I give you that? I can't remember. So compliance is a struggle for a lot of people, and anything we can do to increase compliance is really to the benefit of our pet. In addition to these isoxazoline containing products, we have other drugs that are formulated into other types of products that are either topically applied or formulated into collars. Now, when it comes to protecting dogs from tick-borne pathogens, we're looking a little bit more at vaccination. But we only have vaccines available to protect our dogs from the agent of Lyme disease, Borrelia burgdorferi. So when we think about the vaccines that are available to protect our dog from Lyme disease, there's several available, and they differ in their formulation. Some are bacterins, so they're homogenized whole mixtures of the Borrelia itself. Others are formulated from recombinant proteins. So some of the companies choose one or two immunodominant proteins, so proteins that the immune response of the dog would recognize and make antibody against. So there's some important nuances or differences between the vaccines that are currently available. And depending on the individual vaccine product, the label claim may vary a little bit as well.
So I think, we've covered in a lot of different arenas how nuanced and important it is to have comprehensive tick protection. We've talked about tick products and vaccination. Anything else that we should be aware of to help protect our pets?
So when we think about different strategies to protect our pets from ticks and reduce their risk for acquiring and developing a tick-borne disease, I think we have three general approaches that we can recommend to pet owners. The first is to use a good tick control product, and ideally use that product 12 months out of the year. The second approach is if you know your pet is going to be walking through a ticky area, to go ahead and just do that tick check. So just do a quick survey of them, ruffle their fur, scratch their ears, look for any ticks that may be looking for a nice place to call home for the next week or so. So really advocating for these tick checks. And then finally, for our dogs living or traveling to Lyme endemic areas specifically, I think any of those dogs would benefit from receiving a Lyme disease vaccine.
So we mentioned the tick protection products, that there's monthly and then extended duration products and different types of vaccines. It sounds like there's a lot of options out there.
So there are a lot of options available out there. There's several different monthly products available, but we do know that compliance is a real issue. There is one extended duration product, Bravecto Chews for Dogs, and that product has a 12-week label for a lot of these key tick species that we've been discussing today, including the black-legged tick, Ixodes scapularis. So for people, for pet owners that aren't as good at remembering when to give that next dose, they basically have 12 weeks of protection already baked in. They wouldn't have had to have given, 3 doses of one of the monthly products, for example. So I think these extended duration products can really help build compliance. And at the end of the day, that just helps protect our pets a little bit better. When it comes to the Lyme vaccines, we have dogs that are living in Lyme endemic areas, and we have dogs that are living in areas that weren't classically considered Lyme endemic. So we talked a little bit before about the fact that these ticks are kind of oozing into new areas, and they're taking their tick-borne pathogens like the Lyme disease pathogen Borrelia burgdorferi with them. So in some of these emerging areas of Lyme disease, certainly those dogs would be best protected by also receiving a Lyme vaccine. Growing up in Ohio, as we chatted about before, there really weren't tick-borne diseases for the most ticks or tick-borne diseases for the most part that we were concerned about. And now I'm recommending for my parents and their dogs, they still live in the Cleveland area, to make sure that their dog is getting a Lyme vaccine once a year, because it is emerging in a lot of areas in Ohio and Indiana, down in the Carolinas, in Virginia. So areas that we haven't traditionally considered really Lyme endemic, Lyme is moving into those areas, and we should protect pets that are living or traveling there. We have snowbirds that fly back and forth between colder and warmer climates. If they're taking their pets with them, then certainly any pet that's traveling to a Lyme endemic area would definitely benefit from getting a Lyme vaccine as well. So not all Lyme vaccines are created the same way. Sometimes they can differ based in just how that vaccine is constructed. Is it based on a recombinant protein? Is it based on a whole cell bacterin? They can also vary or differ in terms of the type of immune response that they elicit. So ideally, the type of immune response that we want these Lyme vaccines to elicit is what's known as a borreliocidal response. And so we want them to elicit the generation of antibodies that will work to actively kill Borrelia that may be either in the tick or in the dog. And so I bring up the in the tick because when we vaccinate dogs, one of the most important antibodies that we want these vaccines to make is against a Borrelia surface protein called outer surface protein A, or OSPA. And that's a protein that the Borrelia express when they're in the tick. So what we're basically doing when we vaccinate these dogs is we're vaccinating the dogs. They generate an anti-OSPA antibody response. And then when the tick starts feeding on that dog, when the infected tick starts feeding on that dog, they ingest some of the blood. Along with the dog's blood, they ingest antibody. And those OSPA antibodies actually work to start killing the Borrelia while it's still inside of the tick. Now, some of our Lyme vaccines will also induce an antibody response to another outer surface protein C. And outer surface protein C, or OSPC, first starts getting expressed when the Borrelia is in the salivary glands of the ticks, and right before it's getting dispensed into the skin of the host, in this case, the dog. So we also would like to see the generation of borreliocidal antibodies against OSPC to give kind of an extra level or extra layer of protection. These antibodies will start first killing the Borrelia when it's in the tick, and then any Borrelia that happen to leak through and make it into the skin of the dog, hopefully these borreliocidal anti-OSPC proteins will kill the Borrelia at that moment as well. So one vaccine that we know produces really good borreliocidal OSPA and borreliocidal OSP-C antibodies is Novavax Lyme vaccine. And so people that elect to use, pet owners that elect to use Novavax Lyme have kind of an extra layer of protection. That vaccine is working to kill the Borrelia when it's still inside the tick, and then it's working to kill any Borrelia that perhaps escape and are dispensed into the dog when that tick is immediately feeding. Not all antibodies are created equally either. So I've mentioned these borreliocidal antibodies, which actively work to directly kill the Borrelia, so the Lyme disease bacteria. Sometimes these vaccines can induce other antibodies as well. They're called opsonization antibodies, and they're like stickers that get stuck to the outside of the Borrelia bacteria, and then they'll recruit other cells over to hopefully kill that Borrelia. So some vaccines will produce opsonization antibodies, and then others that'll tag the bacteria for killing, whereas other antibodies will directly kill that Borrelia pathogen themselves. And so we know that Novavax Lyme produces these borreliocidal antibodies that work to kill the Borrelia inside the tick, as well as any Borrelia that happen to make it inside of the dog when the tick is feeding.
And when it comes to vaccinating our dogs, knowing that a majority of them, if they do become infected, will have subclinical disease, is it still important that we go ahead and we vaccinate everybody?
So I think it's important, even though the majority of dogs won't develop full-blown chronic arthritis, to still have them vaccinated if they're living in, adjacent to, or traveling to some of these Lyme endemic areas. I would certainly vaccinate my dog, Lucy Poodle, against Lyme disease if we were going to be traveling together to any of these areas. Because we do know from studies that the majority of dogs do develop some subclinical signs that the average owner wouldn't necessarily pick up on. Maybe their dog is just becoming a little bit slower over time, and that could be the result of a subclinical, more chronic Lyme disease progression. And so one of the best ways that we can then protect our dogs from some of these subclinical manifestations that aren't really super overt that an owner would recognize is by vaccinating them against Lyme disease. And the only vaccine that actually has a claim against some of these subclinical signs and specifically against subclinical arthritis is the Novavax Lyme vaccine. So they've done some really amazing studies that they've published in peer-reviewed journals that have demonstrated that dogs vaccinated with Novavax actually do not have these subclinical arthritic features compared to dogs that weren't vaccinated.
Dr. Reif, thank you so much for joining us today. This has been a fascinating conversation, really educational. Thank you so much.
My pleasure. Thanks for having me.
And a big thank you to Merck Animal Health for partnering with us for this edition of Vet2Vet. Check out NAVCsVetfolio.com for more of our V2V discussions on various topics in veterinary medicine. And remember, if one animal is better off because of you today, it's a great day.